Good day, my name is Paul Jarrett. I'm an orthopaedic surgeon and upper limb surgeon, and I was wanting to talk to you about shoulder impingement today. And shoulder impingement is a relatively common problem, and for some people it can really very significantly influence their life. And I was wanting to tell you about what is happening in your shoulder if you've got impingement and how we can think about treating it. So I've got a model here, and in this model this is a model of a right shoulder with the collarbone at the front, then the shoulder blade at the back, and your arm bone here at the side. And there are a group of muscles around about your shoulder blade called the rotator cuff muscles, and those muscles turn into tendons and go into your arm bone here. Now you see in this model here, this space here, which happens to be called the subacromial space, it's the space between this portion here of your shoulder blade called your acromion and your arm bone. That space there becomes narrower when your arm comes up to the side. And in that space you've got a couple of things. You've got your rotator cuff tendons, and you've also got something called a bursa, which is a little fluid-filled sac that sits between the tendon and the bone. It does a number of things, including effectively lubricating that motion. And in bursitis, what tends to happen is the contents of that space become swollen, and therefore, whereas it previously would have fitted in the space even when it becomes narrower, now they're getting pinched when you use your shoulder in certain activities. So when you bring your arm up to the side, or when you lie on it at night, and that causes pain because that area has got quite a rich nerve supply. It's a little bit more complicated than that, even in terms of the function of those rotator cuff muscles I mentioned. Is really for your ball and socket joint. It helps center your ball in the socket, and as time goes by and people get older, the rotator cuff muscles just get a little bit less good at doing that, and so your joint seems to be just a little bit less stable, and often that space becomes a little bit more narrow. Now, one thing your doctor may have told you is that you've got a spur or a hook on your acromion. That's this portion of your shoulder blade here. And if you see this model here and you look side on at the acromion bone, it's looking very, very flat. And for a portion of people, the bone is a bit curved at the front. And what that means is that the space available for the tendon and the bursa at the front is less than it would be for the average person. And so if you've got a spur or a hook at the front, that isn't necessarily that that's developed and caused the problem, but it's that because your bone's that shape, you're more at risk of getting impingement compared to if the bone had been flat. Now, there are a number of different treatments you can do for impingement. So for instance, if you're a swimmer and you get in the water and you swim to rottenness today, you're probably going to end up with impingement simply from using your shoulder so very much, but that's going to get better. And so there's a group of people who do get impingement every so often simply from doing an awful lot of activities. And of course, if that's the problem for you, you may choose simply to do less of those activities, or if you do those activities and it's sore, take the odd painkiller. So that would be a way of that person managing their problems. Now, if you're coming to see me, it's probably the case that your symptoms are more marked, that you're getting these bouts of impingement more often, or that it's there all the time, unrelenting. And there are a few other treatments we can do. So one option is to get you to see the physiotherapist to help strengthen the muscles in your shoulder and get them to coordinate themselves better. And for a portion of people, that can be very useful. Another thing we can do is put an injection of steroid in your shoulder. So put some steroid into the bursa, which reduces the amount of inflammation there. And steroid as a medicine can only really last at most for 2 or 3 months, but sometimes an injection for bursitis in your shoulder can last long term. And the reason it does that is often you've got impingement, you've got some inflammation in your shoulder, and that inflammation effectively causes the tissues there to be swollen, therefore they're being pinched, and because they're pinched they're inflamed, because they're inflamed they're swollen, because they're swollen they're being pinched, and you can see there's a bit of a vicious circle there. Well, if we put an injection of steroid in, you can often find that that steroid effectively breaks the vicious circle and thereby has a long-term solution for your problems. So again, it depends how bad the problem is and what's happening in that space exactly, but about 75% of people may well find that steroid injection works excellently for a long time or indefinitely. And then another treatment is a surgical option, and if I show you this picture here so this again is acromion looking from the side. So on the model it was relatively flat, and this one it's relatively curved. And so what we can do is an operation where we simply remove the spur. And the way we do that is we make normally 2 or 3 little holes in your shoulder while you're asleep and put a telescope in, have a really good look around so we make sure there's no additional problems in your shoulder, and then using a little shaver shave off that bone and really return the bone to the shape it was for the majority of people. So we're returning the shape of the bone to how it is for 85% of the population, and for the vast majority of people with impingement that works very well. The unfortunate thing is any shoulder operation takes much longer to recover from than you might imagine, because what we're doing is we're removing the original problem in terms of getting rid of the bone that's pinching things, but where the operation has been undertaken there's a healing response from your body, and that involves inflammation and some scar tissue formation, and that produces pain and stiffness in its own right. And of course that healing response dampens down with time, and so therefore gradually your pain disappears and your motion and your function comes back. But it can take a while, so the length of time it takes to recover from that operation does vary a lot from person to person. Some people recover extremely quickly, so I have some patients coming back after a couple of weeks and they're swimming and they're playing tennis and they're feeling very happy with life. That, however, is reasonably uncommon. Most people, it actually takes a large number of months to get absolutely as good as you're going to get, and certainly takes a few weeks before things are becoming reasonable. There are a few risks behind having an operation, such as infection or us injuring structures, both of which are extremely unlikely, and another condition which doesn't happen frequently but can happen, which is called a frozen shoulder, where your shoulder gets much stiffer than we would expect after an operation and takes a lot longer to recover, but that's around about 1 in 50 people. So I hope I've given you some understanding of what impingement is. It's a common problem, and there are a number of different ways of remedying it, and I'm looking forward to discussing your shoulder in the clinic, and we'll see if we can find a solution that's best for you. Thank you.